and also nurse
Hello.
educator, whatever capacity you need me in. The topic today, of course, we know that it's Breast Cancer Awareness Month, and we cannot go without talking about physical wellness and what women need to do as far as doing their breast cancer awareness. Unfortunately,
So let me
these
so Sarah,
yeah.
let me introduce you real let me introduce you
Oh, okay.
to
I
the
thought
land
you were ready.
to the land.
Okay, you didn't start recording
Yes,
though, did you? Did you record? You're not recording, are you?
yes, ma'am. Yes, we are live. We are live.
Girl, we
We
41
are.
seconds in it. Let you go ahead and do the introduction. Go ahead.
Good afternoon, Jules. We are so excited to have my sisters on here with us today. This is so exciting. Today we are talking about focusing on our physical wellness this month, and as everyone knows, this month is October Breast Cancer Awareness Month. We know if it hasn't affected you personally, it has affected someone in your family, whether a close family or not. But today we have an ordinary woman doing extraordinary things. So she is going to give us information from her plethora of experience. 30 plus years as a nurse in other healthcare areas. She's going to give us a little bit background as to what brings this information forth and where she obtained all this wonderful information that she's about to relate to us today. But we are excited, Jules. Those of you that are logging in or will log in, or if you see the replay, you guys just make sure you send a comment. I'm sure if there's any questions as the presentation is going forth or after, she'll be definitely willing. Just put those in the comments. So we want, without further ado, go ahead and get started because y'all didn't come here to hear me talk. So without further ado, I introduce you to Nurse Lorrean Willingham, my Sarah, and the ladies of Sigma Gamma Rho Sorority Incorporated.
Thank you, Sarah. Cameron, and I again want to thank the rest of my Sarah, Madam Bassler, for attending this here. As she already alluded to, Breast Cancer Awareness Month, and this is what we are looking at this particular time. Uh, like she said, we have somewhat been affected or touched by this disease. If not, we always, in lieu of dreading that it might become one of our diseases, can't help but to think that because it's generally is affected by women. So what I wanted to go over today was to just kind of keep you in the loop of some of the things that we try to stress to the general public as far as for women's health for the early detection. Now we know there's no way to prevent this disease because there are other factors that may contribute to you having that breast cancer, such as a family history of it. But one of the things that we really focus on is early detection. The early that this disease is diagnosed, the better prognosis you have for being cured. Now, some of the things as far as we always talk about for early detection is you yourself. We have not some of the older women, we always have to try to talk with them about not being afraid to examine their own bodies. You'll be surprised at some of the women that well, I don't feel on this every now and then, but sometimes if you if you did feel it and felt something that was not there once before, then it might be at a stage where it would not have a good prognosis. So, really, the best way of early detection is doing your breast self exam. We call it BSE, breast self exams. And you can do that easily. I did have some of the diagrams where you could do that. But basically, what you do is you're going to end up raising your arm and then you'll do circular motions and then you will be checking to see if you have any nodules that you have not had before. Another test we do, breast self exam, is when you kind of bend over. If you bend over and look at any dimpling in your breast, that might be a sign that you have a tumor or
Okay.
something. Those tumor attaches to the wall, and when you bend over, it will create a what we call a dimpling. Now, healthcare providers will be better at detecting that than you yourself, but we really want to focus on those self breast exams that you can do every month. Mostly, some of the women that are not having menses anymore, they pick a date, mainly like if I'm on the 15th of January, I would pick the 15th of every month to do that exam. That way you're doing it consistently and you're doing it routinely. Now, women that aren't having their menses, of course, we would like for them to do their post cycle. That way, then their hormones are not up. And sometimes those mammillary glands can get enlarged and tender and everything right before the menses. But the main thing that we really want to focus on is what you can do as far as detect early detection. And if you do find it, then you also need to go to a healthcare provider so that they can further assess you and see exactly, because all nodules in your breast are not cancerous. There are certain nodules in your breast that might be what we call benign. They might be another diagnosis they might give you is fibrocystic breast disease, where you have those nodules that comes up, but they are not cancerous. Now, being in the profession that I am in, of course, I have came across this here disease quite often, and it is very scary to women. It's scary to them. Number one, they think about their survival. Is it gone too far? What's my survival chances? And then some, amazingly, will opt not to have mastectomy. And right now, with the technology
Sarah,
that
I think we're having a slightly bad connection.
okay, well, we need to slow.
No, I can. We can hear you now. Just I was
You
just.
can hear now.
That
Okay.
is fine. Go ahead. Keep going. It was a
Okay.
slightly bad connect. We can. We can.
Okay.
We
All
can.
right.
Okay.
Uh, Getting back to some of the things that you need to do if you did find a nodule in your breast, you do need to go to a healthcare provider so they can further assess you and give you tests. Everything, just because you find it, does not mean a death sentence. It does not mean that you might have to lose your breast. A lot of times, depending on the staging of the disease, yes, they will recommend mastectomy, and then some of them are not full mastectomies. So there are different options that you can have
Okay.
if you do happen to find a nodule and it was cancerous and that they did have to treat you. But what a lot of the 90%, according to stats, is that some of these, a lot of these breast cancer are what they call HER2 positive, which is got to do with hormones and a protein, and they are 90% curable. We know the older we get, the risk is higher for us to develop breast cancer, and that is hormone related. So, again, you need to go to your healthcare provider, and then they can give you what option of plan that you need to follow. If that was the case, like I say, all nodules are not cancerous nodules. So then once you find something that you have, this might be a lump that I didn't feel before, something like that, then even as far as not just the breast, all under the armpit also, because you have lymph nodes under your armpits that connects to those mammary glands, and that can also have nodules in them. So if you find any nodules up in this breast area, right up in here, what we call the tail of Spence, that is where you really need to go and find some help. Go to your regular provider, even if that provider is not a specialist in that area. It would be best to go to them so that they can refer you to someone, doctor to doctor, provider to provide attendance to speed things up in time is important if you are diagnosed with this. Now, I've been going on about the breast self breast exam and what's maybe or may not be cancerous, but we also need to look at some of the risk factors too. Some of the things that we can do that will decrease your chances of having breast cancer. Now, we know because we're women that we're, of course, going to be the population that's mostly affected. However, there is a small demographic of men that also may have breast cancer. Sometimes they might think, oh, I got hit
Okay.
playing touch ball or something like that and have a lump. But I have known very few men that has had breast cancer and had to have mastectomies in chemotherapy. Some of the celebrities they look at they doing what they call genotyping. If you are at risk and you have certain genes, they do prophylactic mastectomies. That is not something all providers would recommend, but again, because you are in charge of your health care, then that is something that some women are opting to do prophylactic mastectomies. One in particular, Angelina Jolette, was one that did that because she had the gene and she went on and had it done. And of course, man, they can make some better than what we born with. So that probably didn't affect her too much as far as appearances, because of course you can get implants. But let's look again at some of the risk factors. And now, some of the risk factors that we know, of course, is being postmenopausal. The older you get, then the higher risk you are for having breast cancer. And we can't do nothing about that because we want to keep living. When you quit aging, you quit living. So we want to make sure that we're living healthy as we can. And the thing that we need to do is keep in touch with our annual uh, mammograms, because insurance was in such an influx between 2010 and 2020 that they start changing. 35, well, really 35 you get a baseline, 40, and after you used to get it annually, now they're saying that some of the age groups can get it every 2 years. I get it annually, especially if you pass 45, you need to get it annually. Same thing as far as, they start changing the guidelines on pap smears. But my focus today is breast. Now, another risk factor is inactivity. We do need to have some form of
Hmm.
physical activity. Can you hear me? Am I fading out?
No, we can hear you. Good
Okay.
I can
information.
hear you.
Okay. Inactivity. We know that, of course, uh, cancer cells are rapid growing cells. And the more weight you are, then those are rapid producing cells also. And they can kind of get mixed up with your normal rapid producing cells. So we really want to watch our weight and then have some form of regular activity where we need to stay active. I don't recommend no one going out there and trying to do all kind of acrobatic exercises, but there are exercises, that are more tailored to what you can do. So we want to again stay active and watch our weight so that we're not very obese. Another thing is alcohol
So,
usage.
Raquel, can we go back? Can
Go
we
back.
go back to one thing before? Can we go back just for a minute? I was watching something. It was a health show, and it was
Hmm.
talking about when you were talking about the exams. I think it was called a dense breast or something like that. Do you know? They said sometimes it can't pick up
That's correct.
certain things.
It is breast density, the thickness of the
Density. That's it.
breast.
Yeah.
Yes, that's what it is. And of course, a lot of African American women, we are naturally heavy in the breast, and other races are
Yes.
too. but African American women tend to be more larger, and that density is thick, and it can be overlooked. Matter of fact, I had a colleague. She was a very heavy-breasted lady, and also moderate obese that was overlooked. And it actually did not start in the breast; it was at the chest wall. So it was some time before,
Oh,
because she kept having this cough, cough, cough. It was some time before they actually diagnosed, because it penetrated through the chest wall and went to the lungs. And then she thought it originated in the lung, but they told her no, it did not. It originated from the breast. So yes, breast density can
wow.
affect that. That's why even the women's clinic, if they have anybody that's like that, they might refer you to another um, a source. I know the diagnostic clinic in South Haven. I went there a couple of times myself, but the diagnostic clinic where they can get a clear picture of the breast, especially if you have a large amount of breast density. Was it any other questions? Did I answer
Okay.
that for you, Sarah Cameron?
Yes, ma'am. Yes,
Sarah
ma'am.
Willingham, a lot a lot of times we see you for breast
Now that question
ultrasound.
is
I've
not
had
coming out
ultrasounds
clear.
done before.
Okay, that
Can you
that
hear me?
question did not come
You
out clear.
break. You're
To
breaking
repeat it,
up.
yes,
Oh, it may be my internet connection. Can you hear me?
yes, I can hear you now.
I said a lot of times they will refer you for an ultrasound. That's the more diagnostic testing that they'll do when they, especially when your breasts are like dense like that. They may do
Mm-hmm.
an ultrasound instead of having you do a regular mammogram.
Mammograms. That's correct. That is correct.
Okay. Okay.
Uh, we do like to have
So at
occasionally.
any point should so at any point should people request it?
You
At
need
any
to
point should someone
you need to talk to your primary your provider that you're following, because the first baseline is for you to get a mammogram, and if they see something abnormal on your mammogram, they will refer
They
you
will
for
okay.
further
refer you.
testing.
Mm-hmm. That is correct. They will refer you to
Okay.
that. And I know they use that diagnostic center in South Haven quite a bit. We all like to have
Okay.
some form of socializing, maybe alcohol, but that is another risk factor, overuse of alcohol. Uh, so if we're going to be socializing and drinking, then of course that's not going to be nothing that you do routinely. But then too, alcohol usage in excess is one of the risk factors. Again, like I say, there's nothing that you can do to prevent it, but you can do things to decrease the risk of having them. And that goes with the inactivity, being morbidly obese, excessive use of alcohol. And then also, one of the other things that risk factors that we don't have any control over is as we get older, uh, being postmenopausal. So again, that is something that you don't have any control over. Another thing I wanted to bring up, especially among African American women, is that we have less breast cancer than Caucasian women. However, our breast cancer are discovered later, so their survival rate is higher, but our survival rate is lower because of the detection, lateness of the detection of the disease. So,
Okay.
and then also, uh, within the last decade or so, they have also been talking about another type of aggressive form of breast cancer with African American women's too. So then again, we again get a double whammy. We discover it late and decreases our chances of survival rate, and then the ones, and usually those hit very young women. I've known some of the women, you wouldn't even start doing the baseline for a mammogram that were in their 20s, that did not survive because they had a very aggressive form of breast cancer. Any questions so far? I don't want to put gloom and doom on it, but these are some of the things that we have to do. Get your annual checkups so that you can get your mammograms done and do your monthly breast self exams so that if you find something that you don't stress. We've even had, especially some of the older women, even if they found a nodule or something, they try to hide it and think, well, maybe it'll go away, or maybe it's not there, and won't seek medical attention because of it. Because some women, they just rather go through the process, and that's their choice too. That's their hair care. They rather not have chemo, or they rather not have a mastectomy. That's how strong some women feel about losing their breasts or losing their hair, because they know if they have chemotherapy and go through these things here, that they're going to lose their hair. And then also the possibility, depending on the type of breast cancer, that they might have to have a mastectomy. So these are some of the things that we hold dearly as women. So you have to be able to approach them in a very non-judgmental way and support whatever decision they make. Of course, you will also let them know the consequences, which their health care provider should always let them know. Those mammograms, and I know all of us have had them, they are something else, because you feel like you've been a pancake when they get through with you. But that is a necessary part that we have to go through as far as getting uh, early detection and keeping our health up as much as possible. Other types of uh, uh, diagnostics is what we call MMRI. Is the imaging is very, very, like Sarah O'Maris was saying, the ultrasound, it goes very, very deep. Some of these MMRIs are so uh, very clear to, you can really see better than what the mammogram would give them. Of course, we always going to focus on early detection. So the earlier, the better the survival rate. And also, we have all of these things with the Cancer Society and breast cancer particularly, that you can reach out to for the 1-800 numbers. And if you did find that, what would you do? And then give them support, because sometimes this is not a subject that nobody never heard of. We all heard of breast cancer, and as women, that's something that we always dread and hope that we never have to battle. But sometimes people just need a little bit of encouragement and get them out of that fear so that they can open up and just, get the help that they need. Because even if they suspect something is wrong, sometimes they will not seek help. So we really need to be mindful of those women that are just scared. And with health insurances, premiums, deductibles, the prices and stuff like that, it was even I that was on the news that one lady did not have health insurance and she found a nodule and she tried
Can
to.
you hear me, Sarah?
You say what? Can you hear me? Am I fading?
Yeah, I think I'm having issues on my end. Go, yeah,
Okay. No, I was just saying
I
it
can
was
hear you.
it was one incident on the news where a lady did not have health insurance and she found a nodule and tried to perform a mastectomy on herself at home,
Mm.
which is horrible. No
Oh Lord.
anesthesia or nothing. So, this is something that's real. We might all have health insurance and able to go to health providers and tell them, go to the health provider, go to the doctor. Some people are not able to do that. And we need to be able to try to find resources for them where they can go and try to get some help, and still they might not have health insurance money to go and pay for a physician to give them a full examination or whatever, or a nurse practitioner, because everything has to be
Absolutely.
paid for. So that can be a very big deterrent for
Yeah.
someone seeking help. Any questions so far? I do want y'all to be happy at the end of this. I don't want to bring doom and gloom, but I do want everyone to think about what you'll be doing, or someone else that you might have contact with, uh, to remind them, as women's, what we need to do for our health, and that we need to do those monthly breast self exams. Questions, Sarah? Any
Absolutely.
questions?
Absolutely.
Well, I've enjoyed you all. I've had some good
I think.
comments and questions.
Well, we thank you, Sarah, for being on today. One of the reasons for doing this session is because so many times, we spend time as women taking care of everyone
Everyone
else.
else. That's
As
correct.
we age, I know for me, getting my mammogram. I do it every year now, with the anticipation that nothing is goes wrong. But I've had like two abnormals, and then they went back and they said it was okay, but it still worries me because
Worries
some
you.
of the things you
Yes.
said, like that late detection and just kind of knowing. I just want to know, and I think the sorors and the ladies who are listening to us, out would want to also know, making sure, giving themselves some type of self assurance that, hey, I'm doing all that I can to ensure. You can't, you know not get it if you're supposed to have it, in a sense.
That's
But you can
that's
know
true.
about it. You can know
Yes,
about
true.
it and know what it is and what it takes in order to do some type of prevention. And I know we're talking about breast cancer today, but as you said earlier, there are so many other diseases that affect women. And I'd like for us to come back together at some point, if you'd be our guest again, and talk about some of those other things, some of those unspoken diseases, some of
Yeah.
those things that you have this and then it affects this, because it's so that physical wellness is a part of being a whole woman. It's a part of that self actualization. So in essence, we have to take care of our physical beings in order to be mentally and emotionally well, and all of those other wellnesses that combine. So I do appreciate the information that you brought forth here today. I do want to see if any of my other sorors have any comments or questions or testimonies that we're on screen. If you'd like to say a word regarding this particular topic, the floor is open now. If you'd like to say anything.
Okay.
Okay. Well, I want to thank you again for being here today. I do want to just throw a couple of announcements out there to UR Jewel, to the ladies of UR Jewel, to the ladies of Sigma. February 16th and 17th, 2024, we will be hosting a women's conference here on the Mississippi Gulf Coast. I'm down here. I'm working down here, right, for a couple of days. So I'm staying here. We're down here, and it's going to center around those seven wellnesses, and just really kind of more information will be coming forth. So just be kind of looking for that on the page. And this segment here is about ordinary women doing extraordinary things, and we just thank you in your line of expertise for being here today, and also being willing to be able to render this information to the ladies. So. Is there any last thing you want to say, Nurse Willingham, or
I just want to
You can
thank
go
you
ahead
for
and close us
having
out.
me, and I'm glad to see my Sarahs, Madam Bachelor, all y'all supporting me. I really appreciate that.
All right. Well, thank you so much. And ladies, thank you all for being a support to not only Sarah Willingham, but also to the You Are Jewel sisterhood. I thank you, ladies. Y'all have a wonderful Sunday.